Hello, and welcome to the Introduction to Medicare. This presentation explains Medicare program basics, including Medicare Part A, hospital insurance, Medicare Part B, medical insurance, Medicare supplement insurance, also known as Medigap, Medicare Advantage, Medicare drug coverage Part D, Medicaid, other programs to help people with limited income and resources, and related resources. My name is Shantae Shipman, and I am the Prince George's County State Health Insurance Program, or SHIP for short, coordinator. I will be presenting the topics. If you have any questions, the instructions will be listed in the next couple of slides. Thank you for being here and wanting to learn more about Medicare. So, getting started with Medicare. Here is a table of contents of each topic that will be discussed. Disclaimer: please leave your email address in the chat to receive copy of slides. Please ensure your mic is muted to avoid any interruptions. Since I am not present during the presentation to answer live questions, please email or call us to answer your questions. Our contact information will be shared on slide 76. Any questions you may have about Medicare will most likely be answered as you progress through the presentation. If not, please do not hesitate to contact us directly. Enjoy. Topic 1. What is Medicare? Topic 1 explains the parts of Medicare, coverage options, automatic enrollment, and enrollment periods. Medicare is health insurance for people who are 65 or older, certain people who are under 65 with disabilities, so you're receiving Social Security Disability, SSDI, people of any age with end-stage renal disease, ESRD, permanent kidney failure requiring dialysis or a kidney transplant. This is also applicable to those who have ALS, also known as Lou Gehrig's disease. What agencies are responsible for Medicare? You have Social Security, which enrolls most people into Medicare. Office of Personnel Management, OPM, handles federal retiree premiums. Railroad Retirement Board, RRB, enrolls both railroad retirees and active employees in Medicare. The Centers for Medicare and Medicaid Services, CMS, forms Medicare policy and administers Medicare coverage, benefits, and payments. They're the federal entity that controls how much the premiums will be, out-of-pocket costs, and also, of course, forms the Medicare policy. What are the parts of Medicare? You have Part A, hospital insurance, Part B, medical insurance, and Part D, drug coverage. Your Medicare options. You have original Medicare, Parts A and B, hospital and medical. You can add on a Part D plan, which will cover your drugs. You can also add supplemental coverage, also known as Medigap. Part B is broken down 80-20. Medicare pays 80% and you pay 20%. If you have a supplemental coverage policy or Medigap, it will cover your 20% out-of-pocket costs. You also have Medicare Advantage, also known as Part C. You have a bundled plan. It includes Part A, Part B, Part D, and extra benefits. Extra benefits such as vision, dental, hearing, and fitness benefits. Medicare does not provide these extra benefits. So if you are looking to obtain the extra benefits, Medicare Advantage includes them through the insurance provider. The difference between Original Medicare and Medicare Advantage is that you'll be working with an insurance provider. Original Medicare does not have an insurance provider, except for Part D, which is separate from Original Medicare. You'll be adding the policy on to Original Medicare. But overall, the main difference between Advantage and Original Medicare is that you'll be working with an insurance provider. If you would like to obtain the extra benefits through Original Medicare, or if you have Original Medicare, you would have to enroll into standalone plans. So instead of one plan that includes all benefits, you'll have Part D, you'll have supplemental coverage, in addition to the standalone plans to provide the additional benefits. Original Medicare versus Medicare Advantage, doctor and hospital choice. With Original Medicare, you can use any doctor or hospital that takes Medicare anywhere in the U.S. You may pay more if your doctor does not accept assignment. You would always want to make sure that the doctor that you're seeing accepts assignment. In most cases, you don't need a referral to use a specialist, as long as they accept Medicare. With Part C, you may need to use doctors and other providers who are in the plan's network and service area. Some plans offer non-emergency coverage out of network, but typically at a higher cost. You may find plans that have a co-insurance still be willing to pay up to 50% of a service you receive out of the network. But if this is something that you are looking for, you will want to make sure that is included in the plan before you enroll. You may need to get a referral to use a specialist if you have Part C. You're working with an insurance company at this point, and they have a set network of who they work with, including hospitals, doctors, and any other specialists you may see. So you would always want to make sure that the doctor is in the network. Original Medicare versus Medicare Advantage plan cost. Original Medicare. So again, for Part B covered services, you usually pay 20% of the Medicare approved amount after you meet your deductible. This amount is called your coinsurance. You pay the monthly premium for Part B if you choose to join a Medicare drug plan. You'll pay a separate premium for your Medicare drug coverage, Part D. There's no yearly limit on what you pay out of pocket unless you have supplemental coverage, like Medicare, supplement insurance, also known as Medigap, Medicaid, employer, retiree, or union coverage. So it is up to you to make sure through your benefits administrator how your retiree or union coverage will work. Sometimes they will act as a Medigap. So you will not need to enroll into a separate Medigap plan because you would already have the coverage. You can choose to buy Medigap to help pay your out-of-pocket costs that Medicare doesn't cover, like your 20% coinsurance. Or you can use your coverage from a current or former employer or union or Medicaid if you qualify. For Medicare Advantage Part C, out-of-pocket costs vary. Plans may have different out-of-pocket costs for certain services. You pay the monthly Part B premium and may also have to pay the plan's premium. Some plans may have a $0 premium and may help pay all or part of your Part B premium. Most plans include Medicare drug coverage, so you will not need to enroll into a separate Part D plan. Plans have a yearly limit on what you pay for covered Medicare services, which may include different limits for in-network and out-of-network services. Once you reach your plan's limit, you'll pay nothing for covered services for the rest of the year. You will know this amount before you enroll into the plan of your choice. You can't buy Medigap to cover your out-of-pocket costs. However, you may be able to use coverage from a current or former employer or union or Medicaid if you qualify. So you cannot enroll into both Medigap and Part C. It would have to be one or the other. Medigap plans do not partner with Medicare Advantage plans, but you will also receive the same benefits such as cost sharing. The difference is the 80-20 breakdown. It is not on most plans. It's the 80-20. 80% Medicare pays for 20%. Part C may cover more than 80% or less than 80%. It depends on the plan. Original Medicare versus Medicare Advantage plan coverage. Original Medicare covers most medically necessary services and supplies in hospitals, doctors' offices, and other healthcare facilities. Original Medicare doesn't cover some services like routine physical exams, eye exams, and most dental care. Routine physical exams does not include your annual physical exam. It could be something you could have received when you were a child, but they decided to request it at a later age. Medicare will not approve it. In most cases, you don't need approval, prior authorization for Original Medicare to cover your services or supplies. You could join a separate Medicare drug plan to get Medicare drug coverage Part D. With Medicare Advantage, plans must cover all medically necessary services that Original Medicare covers. Plans may also offer extra benefits that Original Medicare doesn't, such as the vision, dental, hearing, and fitness benefits. You may need to get approval or prior authorization from your plan before it covers certain services or supplies. Most Medicare Advantage plans include Part D, and you don't need to join a separate Medicare drug plan. Foreign travel. Original Medicare generally doesn't cover medical care outside of the U.S. You may need to purchase a Medicare supplement insurance plan, also known as Medigap, that covers emergency care outside of the U.S. So there's a hidden benefit that may be within the Medigap plan. You would have to confirm this before you enroll into the Medigap plan. And the same with Part C. Plans generally don't cover medical care outside of the U.S., but some plans may offer the benefit. You would have to make sure that it includes the benefit before you enroll. But overall, Medicare itself does not cover care outside of the U.S. You would have to have either a Medigap policy or a Part C plan that includes the benefit. Medicare may pay for inpatient hospital, doctor, and ambulance services you get in a foreign country in these rare cases. You're in the U.S. when a medical emergency occurs, and the foreign hospital is closer than the nearest U.S. hospital that can treat your medical condition. You're traveling through Canada without unreasonable delay by the most direct route between Alaska and another U.S. state when a medical emergency occurs, and the Canadian hospital is closer than the nearest U.S. hospital that can treat the emergency. Or if you live in the U.S. and the foreign hospital is closer to your home than the nearest U.S. hospital that can treat your medical condition, regardless of whether an emergency exists. Medicare may cover medically necessary ambulance transportation to a foreign hospital only with admission for medically necessary covered inpatient hospital services. Automatic enrollment, Medicare Part A and Part B. Enrollment is automatic for people who get Social Security or Railroad Retirement benefits. You are under 65 and have a disability, and getting disability benefits from Social Security or certain disability benefits from the Railroad Retirement Board for 24 months. By the 25th month, you'll be automatically enrolled into Medicare. Look for your Get Ready for Medicare package. It is mailed 3 months before your 65th birthday, your 25th month of disability benefits. It includes a letter, booklet, and Medicare card. Some people must take action to sign up for Medicare. To apply for Medicare 3 months before you turn 65, contact Social Security at ssa.gov or by phone 1-800-772-1213. Again, that is 1-800-772-1213. If you retired from a railroad, contact your local Railroad Retirement Board at 1-877-772-5772. The age for full Social Security retirement benefits is increasing, However, Medicare eligibility age is still 65. Your Medicare card. This is what it looks like. It is red, white, and blue. It includes your name, Medicare number, your hospital Part A, and or your medical Part B, along with its coverage start date. It includes either one or both. To refuse Part B, follow the instructions in the Get Ready for Medicare booklet. To accept it, you would just keep it. If you need a replacement, you can visit Medicare.gov or contact 1-800-Medicare. When to sign up or make changes to your Medicare coverage. We will go through each enrollment period on the next couple of slides. Your 7-month period. Initial enrollment period. This is the first time you're ever applying to Medicare. To sign up 3 months before your 65th birthday, you contact Social Security and it will begin your birthday month. If you sign up for Medicare after or during your birthday month, your 65th birthday month, it will start the following month. If you're under 65 and have a disability, you'll automatically get Part A and Part B after getting 24 months of disability benefits, either from Social Security or certain disability benefits from the Railroad Retirement Board. In order to sign up for a Medigap policy to couple with your original Medicare, if that will be the route you'll be taking, you will wait until your 65th birthday because Medigap is only applicable to those who are 65 or older. This is also the only time where you're protected from underwriting, which is where insurance companies will hire a third party or do it themselves to evaluate your past or current health conditions. At this time, if you have a lot of issues or you have issues going on with your health, they can refuse to sell you a policy or give you an astronomical price. So it is best to confirm which route you would like to take, whether you're going with Medigap or Part C during your initial enrollment period. However, if you're still working and you have an active group health plan, which is your employer's health insurance, you will still be eligible to be protected once you stop working. So for example, if you're working at 70 and you're applying for your Medicare, the underwriting process will not be applicable to you. You will still be protected because it'll be your first time applying for Medicare. Another example, if you begin work, well, if you're still working at 65 and you take Medicare Advantage when you first apply, and later on when you're 80, you want to apply for a Medigap policy. You can do that, but there is a chance that you will be refused or pay a higher amount. So you're not protected like you're protected during your initial enrollment period, or if it's your first time applying to Medicare because you were covered by your group health plan. All right, so special enrollment period continues for 8 months after your group health plan ends. So if you're still working after the age of 65, you have the opportunity to keep your group health plan. This will protect you from penalty as long as you're covered by an active group health plan. You can sign up for Part A if you have to pay for it and or Part B. But anytime you're still covered by your group health plan, you are protected and you do not have to apply. During the 8-month period that begins the month after the employment ends or the coverage ends, you can apply for Medicare. But it is not mandatory if you're still covered by your group health plan. So if you're still working after the age of 65, you're covered by your group health plan, and then you stop working, you can apply for your Medicare without penalty. It is not mandatory for you to apply for your Part A or B, but most people apply for their Part A hospital insurance because it's free if you work 10 years or more and paid FICA taxes. This is based on either your employment history or your spouse's employment history. So if you don't have 10 years of paying FICA taxes, but your spouse does, they will go based on your spouse's work history. But there is no premium for Part A if you have paid 10 years of FICA taxes or have the credits to apply. General Enrollment Period, GEP. This is a 3-month period the following year, January 1 through March 31st, after the annual enrollment period. We'll get into that. But the general enrollment period, you can sign up for Part A if you have to buy it, Part B, or Part D. So, for example, if you do not qualify for a special enrollment period, or this is not your initial enrollment period, you have surpassed the 7-month period and you do not qualify for a special enrollment period, you will be subjected to this general enrollment period. And at this time, you may have late enrollment penalties. Coverage begins the first day of the month after you sign up. The yearly open enrollment period. This is a 7-week period where you can join, drop, or switch Medicare Advantage plans or Medicare drug plans. This is a time to review health and drug plan choices. Once you switch, your coverage will begin January 1 of the following year. This is a time to review plans to ensure your drugs are covered at an affordable rate and your out-of-pocket costs are still affordable. Some people are enrolled into the same plan for years, not knowing that they can enroll into a plan that's much more affordable with more coverage. You want to make sure you review your plan benefits. If transportation is one benefit that you're looking for, one plan may offer it, one plan may not offer it. So you want to make sure that your plan covers all of the benefits that you're seeking, and of course at an affordable rate. You also want to make sure before you switch that your doctor accepts the new plan if you want to continue to see the doctor. Now, the Medicare Advantage open enrollment period is another opportunity to switch to another Medicare Advantage plan with or without drug coverage. Drop your Medicare Advantage plan and return to original Medicare. If you do, you can join a Medicare drug plan, and coverage begins the first of the month after you join the plan. So this is designated for those who are already enrolled into a Medicare Advantage plan. You do not have to use the yearly open enrollment period, which is October 15th through December the 7th. You can utilize this period if you're already enrolled into a Medicare Advantage plan. The difference is the start date. If you use the yearly enrollment period, it will begin the first of the following year. If you utilize this period, it will begin the first of the following month. Medicare Advantage and Part D special enrollment periods. You may qualify for a special enrollment period if you move out of your plan's service area, have Medicaid and Medicare, or qualify for a low-income subsidy, are in a plan that leaves Medicare or reduces its service area. You will receive a letter in the mail confirming that you qualify for a special enrollment period if either of those situations apply. Leave or lose employer or union coverage. Want to enroll in a 5-star plan. This is where you have quality ratings of 5 stars across the board. You can enroll into that plan and that plan only for that period. If you are sent a retroactive notice of Medicare entitlement. Open enrollment period for institutionalized individuals. The open enrollment period for institutionalized individuals, OEPI for short, is continuous for eligible individuals. Your chance to join, switch, or drop coverage lasts as long as you live in the institution and for 2 full months after the month you leave the institution. A Part D special enrollment period will be provided to an individual who moves into, resides in, or moves out of an institution. A Medicare Advantage eligible institutionalized individual can make an unlimited number of Medicare Advantage enrollment requests during the OEPI. Since the OEPI is continuous for eligible individuals, Original Medicare is also open continuously. Therefore, Medicare Advantage organizations must accept requests for disenrollment from their Medicare Advantage plans during the OEPI. Whether or not Medicare Advantage plan is open to accept enrollment. Please note the definition of institution here differs from that used in determining when an institutionalized full benefit dual eligible qualifies for the low income subsidy co-payment level of 0. An individual using the OEPI to disenroll from a Medicare Advantage plan that includes Part D benefits plan is eligible for a special enrollment period to request enrollment in a Part D plan. The SEP begins with the month the individual requests disenrollment from the Medicare Advantage plan and ends on the last day of the second month following the month Medicare Advantage enrollment ended. This period is specifically designated for those living in a nursing home or nursing home-like institution. This differs from those who live in the community. Topic 2. Original Medicare, Part A, Hospital Insurance, and Part B, Medical Insurance. Topic 2 explains the coverage and cost of Medicare Part A and Medicare Part B. Part A, Hospital Insurance. It covers inpatient care in a hospital, including semi-private room, meals, general nursing, certain drugs, including methadone to treat an opioid use disorder, other hospital services and supplies. Inpatient care in a skilled nursing facility, or SNF for short, after a related 3-day inpatient hospital stay. This does not include the admission date or the discharge date. So we're really looking at a 5-day period. Part A hospital insurance also covers blood, only if it's in the hospital's blood bank. Hospice care, home health services, inpatient care in a religious non-medical health care institution, RNHCI. Paying for Part A hospital insurance in 2026. Most people don't pay a premium for Part A. If you or your spouse paid FICA taxes for at least 10 years, you get Part A without paying a premium. You may have to pay a penalty if you don't sign up when first eligible for Part A if you have to buy it. So you may be able to buy Part A if you do not qualify for a premium-free Part A. Your monthly premium may go up 10%. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. If you are not eligible for premium-free Part A, you may be able to buy Part A if you're 65 or older and you've signed up for or are enrolling into Part B and meet the citizenship and 5-year residency requirements. In order to enroll into Medicare, if you're from another country, you would have to be in the U.S. for 5 years. Under 65, have a disability, and your premium-free Part A coverage ended because you returned to work. If you're under 65 and have a disability, you may continue to get premium-free Part A for up to 8.5 years after you return to work. In most cases, if you choose to buy Part A, you must also have Part B and pay monthly premiums for both. The Part A premium amount depends on how long you or your spouse worked in Medicare-covered employment. Social Security determines if you have to pay a monthly premium for Part A. The Part A premium for a person who has worked less than 30 quarters of Medicare-covered employment is $518 in 2026. Those who have been between 30 and 39 quarters of coverage may buy Part A at a reduced monthly premium rate of $285 for 2026. So the further you are away from 40, the more you will have to pay. The closer you are to 40 quarters, the less you will have to pay. If you aren't eligible for premium-free Part A and you don't buy it when you first become eligible, your monthly premium may go up 10% for every 12 months you didn't have coverage. You'll have to pay the higher premium for twice the number of years you could have had Part A but didn't sign up. Benefit periods in original Medicare. A benefit period refers to the way that original Medicare measures your use of hospital and skilled nursing facility level of care. A benefit period begins the day you're admitted as an inpatient in a hospital or SNF. It ends after being home for 60 days in a row and not in a hospital or skilled nursing facility. You may pay a Part A deductible for each benefit period. There is no limit to the number of benefit periods you can have. So, for example, if you go into the hospital, you're admitted, you're there for about 10 days. You pay your deductible in the beginning of the period, and then you're there for 10 days. You go home at day 15. Let's say you go back to the hospital 2 days later. You're 17 days into the benefit period. When you go back to the hospital, you do not have to pay the premium or the deductible. However, if you go home and you're there for 60 days consecutively, and you go back to the hospital after 60 days, you will have to pay the Part A deductible again. So each benefit period, you would have to pay the deductible for Part A. So this is the deductible for each benefit period. So what you pay in original Medicare in 2026. As you can see, the deductible for Part A is $1,736. For days 1 through 60, it'll be $0 for each copayment day. After day 60, as you can see, between 61 and 90, you will pay $434. Once you go beyond day 90, but still within 150 days, you'll pay $868 per day. If you look at after day 150, you pay all costs. This is the same for mental health inpatient stay. It is the same amount, $1,736. Days 1 through 60. Beyond that, you pay the copayment for each day. Each day after the lifetime reserve days, you pay all costs. You also pay 20% of the Medicare approved amount for mental health services you get from doctors and other healthcare providers while you're in a hospital. Part A hospital insurance costs in 2026 continued. Skilled nursing facility stay. Days 1 through 20, you'll pay $0 for each benefit period. Beyond day 20, you'll have a copayment for each day. Beyond day 100, you pay all costs. Home health services, $0 for home health services. Home health services, the only person that can qualify you or certify you to need home health services is your treating doctor, primary doctor or treating doctor. They also pay 20% of the Medicare approved amount for durable medical equipment like wheelchairs, walkers, hospital beds, and other equipment. Hospice care is $0 for hospice care services. You may need to pay a copayment of no more than $5 for each prescription, drug, and other similar products for pain relief and symptom control while you're at home. In the rare case your drug isn't covered by the hospice benefit, your hospice provider should contact your Medicare drug plan to find out if it's covered under Medicare Drug Coverage Part D. You may need to pay 5% of the Medicare approved amount for inpatient respite care. Medicare won't pay room and board for your care in a facility, unless the hospice medical team decides you need short-term inpatient care to manage pain and other symptoms. This care must be in a Medicare-approved facility, like a hospice facility, hospital, or skilled nursing facility that contracts with the hospice. So hospice is mainly provided at home, except under accepted situations. Blood. If hospital gets it from a blood bank at no charge, you have no charge. If the hospital has to buy blood for you because your blood type is not in the blood bank in the hospital that you're admitted into, you must either pay the hospital cost for the first 3 units of blood you get in the calendar year or have the blood donated by you or someone else. If you have a Medigap policy, for example, they have a blood benefit. So if you know that you're someone who constantly gets blood transfusions because of a condition you may have, and you have a rare blood type, that is a benefit that you will look at to include in your Medigap if you were to go that route. Do I need to sign up for Part A? Consider it's free for most people. You can pay for it if you or your spouse's work history isn't sufficient. There may be a penalty if you delay. Talk to your benefits administrator if you or your spouse are actively working and covered by an employer plan to see how Medicare works with it. Medicare Part B covers these services listed here. You will get a copy of the slides if you need to confirm exactly what is covered, but it includes doctor services, testing, wheelchairs, walkers, home health services, outpatient mental health care services. This is basically your preventive service benefit. So if you need to get certain screenings and therapies, you will be able to utilize Part B. Here is another list of Part B preventive services in which you will receive via email. But screenings, counselings, vaccinations, your yearly wellness visit, and just your overall preventive care benefit is Part B. What's not covered by Parts A and B? Eye exams, long-term care, cosmetic surgery, massage therapy, routine physical exams, hearing aids and exams for fitting them, concierge care, covered items or services you get from a doctor or other provider that has opted out of participating in Medicare, and most dental care. They may be covered if you have other coverage like Medicaid or Medicare Advantage plan that covers these services. What you pay in 2026 Part B monthly premiums. So the standard premium is $202.90. Some people who get Social Security benefits pay less due to the statutory hold harmless provision, which means they're locked in at a certain premium rate and it will not increase as the yearly standard premium increases. Your premium may be higher if you didn't choose Part B when you first became eligible or if your income exceeds a certain threshold. Now, if your income exceeds a certain threshold, you will not pay the standard premium. You will have what's called an income related monthly adjustment amount, also known as IRMA. These are the rates for 2026. So basically, if you make over $109,000, you will pay more. If you have $109,000 as an individual or less, you'll pay the standard. Now, if you filed a joint tax return, you'll pay the standard amount if you have $218,000 or less. And if you filed married and separate tax returns, it'll be applicable $109,000 or less, you'll pay the standard. But basically, the more you make, the more you'll have to pay, according to this chart. And the base or the number that they go by, it increases every year. So it could be $109,000 this year, but it'll be a different amount next year, just like it was a different amount last year. They will go back 2 years of your tax returns to determine if you are eligible for an IRMA or not. Now, if you are not working 2 years later and your income is not the same as it was 2 years prior because you were actively working, you can get an IRMA adjusted or removed depending on your income at the time you're applying. So there is a separate form for that that you would have to submit in order to confirm your income has changed and you are no longer eligible for the IRMA. Would you pay an original Medicare in 2026? Your yearly deductible is $283. You pay this deductible once a year. Once you pay this amount, that's when Medicare pays 80% and you pay 20%. But this amount must be met before the split. Coinsurance for Part B services, so 20% for most covered services like doctor services and some preventive services if providers accept assignment. $0 for most preventive services. So most, meaning not all preventive services will be $0. You will probably have a coinsurance. 20% for outpatient mental health services and copayments for hospital outpatient services. Should I keep and or sign up for Part B? Consider most people pay monthly premium. It is usually deducted from your Social Security or Railroad Retirement Board benefits. Amount depends on income. You can delay enrollment if you have a group health plan coverage based on your current employment, or the employment of a spouse or a family member if you're disabled. So if you or your spouse are still working, you do not need to apply for Part B until you stop working. Otherwise, it'll be a duplication of services. You can apply for Part B at any time while working and continue for 8 months after employment ends or GHP ends, whichever comes first. You should contact your employer or union benefits administrator to find out how your insurance works with Medicare and if you should sign up for Part B during your initial enrollment period. Sometimes you must have Part B. When you must have Parts A and Part B. To buy a Medicare supplement insurance or Medigap policy, to join a Medicare Advantage plan, you're eligible for TRICARE for Life. TRICARE for Life is for military families. You have to have both in order to be applicable for TRICARE. Eligible for civilian health and medical program of the Department of Veteran Affairs. Employer coverage requires you to have it because they have fewer than 20 employees. This is why it's important to contact your benefits administrator before you make any decisions with Medicare, including this situation. Topic 3. Medicare Supplement Insurance, Medigap Policies. Topic 3 talks about searching for and buying Medicare Supplement Insurance, also known as Medigap, coverage that can help with some of the out-of-pocket costs associated with original Medicare. So, Medicare Supplement Insurance Medigap policies help pay out-of-pocket costs in original Medicare. They are sold by private health insurance companies. Some policies also cover benefits original Medicare doesn't cover, like medical care when you travel outside the U.S. All standardized Medigap policies offer the same basic benefits, no matter where you live or which insurance company you buy the policy from. Medigap plan coverage in 2026. So, in order to choose a Medigap policy, you will look at the benefit that is listed in the left column. Those benefits are what's covered under Medigap policies. Each letter covers a certain percentage or not at all per benefit. Plans C and F are not applicable to those who are eligible for Medicare after January 1, 2020. As you can see, they offer basically most of the benefits and at 100%. The next two plans that may offer more coverage than the other letters are plans D and G. So first you would confirm which benefits are the most important to you. After, you will confirm which letter covers each benefit that you're interested in. From there, you will confirm which insurance companies offer the letter of your choice. From there, you will compare each company with their ratings. Each company has their own pricing in what they will offer as far as the amount that you will pay per month. This amount is not locked in. It will change, sometimes on an annual basis. When's the best time to buy a Medigap policy? Again, begins the month you're 65 or older and enrolled into Part B. You must also have Part A. It lasts at least 6 months, maybe longer in your state. Here it is 6 months. During your Medigap open enrollment periods, companies cannot refuse to sell you any Medigap policy they offer, make you wait for coverage, or charge more because of past or present health problems. So again, this is the only time you're protected from underwriting. Otherwise, these three situations will apply to you if you're outside of that. Decision: do I need a Medigap policy? Can I get a Medigap policy if I have a Medicare Advantage plan but plan on returning to original Medicare? Yes. What if I have other supplemental coverage like from an employer? You might not need a Medigap. Medicare deductibles and copayments. Weigh this against how much the monthly Medigap premium costs. What does the monthly Medigap premium cost? It could vary. How to buy a Medigap policy. Consider these steps. Decide on a Medigap plan. A through N is in Nancy. Find insurance companies that sell Medigap policies in your state. Check on Medigap protections in your state. Shop around. Consider plan and price. Don't just go with one. Of course, you want to make a list and compare the pricing since they all vary in prices. Choose the insurance company and the Medigap policy that offers the letter. Apply for the policy. Now, Medicare.gov does have an option to review Medigap policies, but you cannot enroll directly into the Medigap policy from the website. Topic 4. Medicare Drug Coverage Part D. Topic 4 explains Medicare drug coverage, associated costs, and how to choose and join a plan. Medicare Drug Coverage Part D is an optional benefit available to all people with Medicare. It is only optional if you already have coverage, and you can already have coverage through your previous job or your current job, TRICARE, or creditable drug coverage. It is run by insurance companies and other private companies approved by Medicare. It is provided through Medicare drug plans, sometimes called a prescription drug plan or PDP. Work with original Medicare only. Medicare Advantage plans with drug coverage, sometimes called MAPDs. Some other Medicare health plans. How Part D works. It's optional only if you have creditable drug coverage. Otherwise, it is not optional. We know how much Medicare, or not even just Medicare, but how much drugs cost. You just want to make sure you're enrolled into the best plan. It is not optional if you do not have coverage, creditable drug coverage at that. You can choose a plan and join. You may pay a lifetime penalty if you don't have other creditable drug coverage and join a Part D plan after you're first eligible. Plans have lists of covered drugs, also known as formularies, which must include a range of drugs in each category, may change during the year. You'll be notified. If you have limited income and resources, you may get extra help. And we'll get into what extra help is later on in the slides. Medicare drug plan costs and what you pay in 2026. Most people will pay a monthly premium, a yearly deductible, if applicable, co-payments or co-insurance, and out-of-pocket costs capped at $2,100. Last year it was capped at $2,000, but the year before that, or years before that, it was capped at $8,000. The Inflation Reduction Act reduced the $8,000 cap to $2,000 last year and $2,100 this year. Income-related monthly adjustment amount IRMA is also applicable to Part D. The numbers are still the same as far as the base of $109,000 for an individual and $218,000 or less if you file jointly. The amounts of your plan premium plus the amount for the IRMA is how they calculate how much you'll pay for the IRMA for Part D. So as you can see in the chart, the more you make, the more you have to pay on top of your plan premium, YPP. Part D late enrollment penalty for 2026. You may have to pay more if you wait to join unless you have creditable prescription drug coverage or extra help. You'll pay the penalty for as long as you have coverage. So this is the formula that they use to calculate the penalty. The base beneficiary premium changes each year. This year it is $38.99, and this is how they calculate your penalty. Who can join Part D? To join a Medicare drug plan, you can have A or B. You do not need both to join a Part D plan. But if you want to join a Part C plan with drug coverage, you'll have to have both Parts A and B. To join a Medicare cost plan with drug coverage or a PACE program, you'll have to have Part A and Part B or Part B only. When can I join a Part D plan? Can I join during my 7-month initial enrollment period? Yes, it starts 3 months before the month you turn 65, or if you get Medicare due to a disability, it starts 3 months before your 25th month of disability. Can I join if I'm getting disability benefits? Yes, you can join starting 3 months before your 25th month of disability and ending 3 months after your 25th month of disability. Can I sign up, switch, or join during the yearly open enrollment period? Yes, it's from October 15th through December the 7th. Coverage begins January 1. What if I get Part B for the first time during a general enrollment period? You can sign up for a Medicare drug coverage starting the date you submit your Part B application. What if I'm in a Medicare Advantage plan on January 1, but I want to switch to Original Medicare? You may add Medicare drug coverage if you switch during the Medicare Advantage open enrollment period, January 1 through March 31st. What if I'm new to Medicare and enrolled in a Medicare Advantage plan during my initial enrollment period? You can make a change within the first 3 months you have Medicare. Are there other times when I can join, drop, or switch coverage? Yes, in certain limited circumstances. Decision. Should I join a Part D plan? If you have creditable drug coverage, consider cost and coverage. Will you or your spouse or dependents lose your health coverage if you join a Part D plan? How do your out-of-pocket drug costs compare to out-of-pocket drug costs with a Part D plan? How will your costs change if you get extra help with Part D plan costs? If you don't have creditable drug coverage, consider possible penalties. Will joining when you're first eligible help you avoid a likely lifetime late enrollment penalty if you join a plan later? Do you qualify for extra help? If so, you may join a plan without penalty. Choosing a Part D plan. Compare plans by computer or phone. Find health and drug plans at Medicare.gov. Also, you can contact your local SHIP, which is us, State Health Insurance Program. To join a Medicare drug plan, you can join online, call 1-800-MEDICARE, join on the plan's website or call the plan, or complete a paper enrollment form. The plan will notify you whether it has accepted or denied your application. Topic 5. Medicare Advantage and other Medicare health plans. Topic 5 explains Medicare Advantage Part C, cost plans, and programs of all-inclusive care for the elderly, PACE. Medicare Advantage Plans Part C is another way, other than original Medicare, to get your Medicare Part A, hospital insurance, and Part B, medical insurance coverage. It is offered by Medicare-approved private companies that must follow rules set by Medicare. Most Medicare Advantage plans include drug coverage Part D. In most cases, you'll need to use healthcare providers who participate in the plan's network. Some plans offer non-emergency coverage out of network, but typically at a higher cost. How Medicare Advantage plans work. In a Medicare Advantage plan, you are still in Medicare with all rights and protections. Still get services covered by Parts A and B. Can't be charged more than original Medicare for certain services like chemotherapy, dialysis, and skilled nursing facility care. May choose a plan that includes drug coverage and/or extra benefits like vision, dental, or fitness and wellness benefits. Also, hearing benefits. You also have a yearly limit on out-of-pocket costs. Just a note, you are still in Parts A and B if you have C, and you will still be responsible for paying the Part B premium if you choose to go with Medicare Advantage. Most people think because they're in Part C that A and B just disappears. It doesn't. You are still enrolled and you will still need to pay a Part B premium. Each plan has a service area in which its enrollees must live. You or a provider acting on your behalf can request to find out if an item or service will be covered by the plan in advance. It's called an organization determination. Medicare pays a fixed amount for your coverage each month to companies offering Medicare Advantage plans. Each plan can charge different out-of-pocket costs and have different rules for how you get services, which could change each year. Original Medicare covers hospice care, some new Medicare benefits, and some costs for clinical research studies. So there are different types of Medicare Advantage plans. You have the Health Maintenance Organization HMO plan, Preferred Provider Organization PPO plan, Special Needs Plan SNP, which you'll have to have both Medicaid and Medicare to join. The other two are not applicable in Maryland. So the difference between HMO and PPO is the flexibility within the network. HMOs, which includes Kaiser or Alderwood, are both HMO Medicare plans, have a stricter network. You have to stay within a network. Preferred Provider Organization or PPO, we have Blue Cross Blue Shield and Humana. You have a little more flexibility than an HMO when you enroll into a PPO. When can I first join a Medicare Advantage plan? You can join when you first qualify for Medicare, generally during your initial enrollment period, which begins 3 months before you first qualify for both Parts A and B. What if I have Part A and sign up for Part B during the general enrollment period? You can join a Medicare Advantage plan with or without drug coverage. If I can join a Medicare Advantage plan, when can I make a change? You can make changes during the yearly open enrollment period, a Medicare Advantage open enrollment period, or a special enrollment period. How do I join a Medicare Advantage plan? Medicare.gov, you can enroll directly into the plan of your choice. You will first create an account, add your drugs to ensure you're enrolled into a plan that covers your drugs. It will then list the plans that are the most cost effective first, and you will be able to enroll into the plan directly from the website. The plan will have 10 days after you submit your application to make a decision on approving or denying your application. Once you understand the plan's rules and costs, here are other ways to join. Visit the plan's website to find out if you can join online. Fill out a paper enrollment form. Call the plan you want to join. Visit Medicare.gov to get your plan's contact information, or you can call 1-800-MEDICARE. Should I join a Medicare Advantage plan? Consider if the plan offers extra benefits in addition to original Medicare benefits, and if you need to pay extra to get them. Are my doctors in the plan's network? You may need a referral to use a specialist. You can only join or leave a plan during certain periods. It doesn't work with Medigap policies. You must have Medicare Parts A and B to join, and you must pay the Part B premium and usually a monthly plan premium. How are Medigap policies and Medicare Advantage plans different? Both are ran by private companies. Medigap is state, Medicare Advantage is federal. Medigap works with original Medicare. It does not work with Medicare Advantage plans. Medigap gaps in original Medicare coverage, like deductibles, coinsurance, and copayments for Medicare covered services. With Medicare Advantage, Part A and Part B covered services and supplies may also cover things not covered by original Medicare, like vision and dental, hearing, and fitness benefits. Most Medicare Advantage plans include Medicare drug coverage. You must have both Parts in A and B to enroll into both, and you have a premium for both. Other health plans, program of all-inclusive care for the elderly PACE plans. To qualify, you must be 55 or older, live in the service area of a PACE organization, need a nursing home level of care as certified by your state, be able to live safely in the community with the help of PACE services. Other health plans, program of all-inclusive care for the elderly PACE continued about PACE coverage and premiums. If you have Medicare but not Medicaid, you'll be charged a monthly premium to cover the long-term care portion of the benefit and a premium for Medicare drug Part D coverage. If you have Medicaid, you won't have to pay a monthly premium for the long-term care portion of the benefit. So if you go into Medicare.gov and you're looking for a Part C plan, you'll see what's called Erickson Advantage. Erickson Advantage is designated to those who only live in a PACE. So you will not be able to enroll into Erickson Advantage if you do not live in a PACE. Topic 6. Help for people with limited income and resources. Topic 6 reviews options for people with limited income and resources, like the Medicare Savings Programs, Extra Help, Medicaid, and the Children's Health Insurance Program, CHIP. So help for people with limited income and resources. We will get into each of the topics listed here, starting with the Medicare Savings Programs. The Medicare Savings Programs are Qualified Medicare Beneficiary Program, which pays Part A and Part B premiums and other cost sharing like deductibles, coinsurance, and copayments. These are the limits in which you must qualify in order to receive the service. The Specified Low Income Medicare Beneficiary Program, or SLIMB for short, pays your Part B premiums only. QI hours in Maryland is called SLIMB 2. These are the limits in which they must or they will pay your Part B premium. You also have Qualifying Disabled and Working Individuals, QDWI, where it will pay your Part A premiums only. In Maryland, it is our program or for QDWI is EID, which is located in Baltimore. Employed Individuals with Disabilities. So the programs are designated to assist with either, depending on your income, either your Parts A and B premiums and other cost sharing, like your 20%, which is QMB, QMB. The other two programs, SLIMB and SLIMB 2, pays for your Part B premiums only, and QDWI pays for your Part A premiums only, if you have to pay it. What is Extra Help? So, Extra Help helps to pay for your Part D cost only. This includes your premiums and out-of-pocket costs. You can either get full Extra Help or partial Extra Help. The monthly income for individuals is $2,015 a month. The asset limit for individuals is $16,590. This excludes the house you currently live in. So if you have one house, they won't count it. But if you have more than one house, they will count it as an asset. Monthly income for married couples is $2,725 a month, and the asset limit for married couples is $33,100. Most people with Medicare can only switch plans at certain times of the year, but if you have Medicaid or get extra help, you may be able to change your standalone drug coverage once per month. Qualifying for extra help. You automatically qualify for extra help if you get full Medicaid coverage, supplemental security income or SSI, help from Medicaid paying your Medicare premiums or Medicare savings programs, sometimes called partial dual. If you don't automatically qualify, you must apply online, SSA.gov, or complete a paper application. What is Medicaid? A lot of people get this confused between Medicaid and Medicare, but they're two different programs. Medicaid is a joint federal and state program. Helps pay health care costs for people with limited income and resources, or whose medical expenses exceed their available income. Some people qualify for Medicare and Medicaid. May cover services that Medicare may not or may partially cover, like nursing home care, personal care, and home and community-based services. How are Medicare and Medicaid different? So Medicare is federal, Medicaid is joint federal and state. Medicare is health insurance for anyone 65 and older, certain younger people with disabilities, and people of any age with ESRD. Medicaid is health coverage for some people with limited income and resources. Medicare is the nation's primary payer of inpatient hospital services to the disabled, elderly, and people with ESRD. Medicaid is the nation's primary public payer of acute health, mental health, and long-term care services. What's the Children's Health Insurance Program, CHIP? It is health coverage for uninsured children and families earning too much to qualify for Medicaid, but too little for private insurance. It is jointly funded by federal and state governments. It is administered by the states. Key points to remember. Medicare is a health insurance program. Medicare doesn't cover all your health care costs. You have choices in how you get coverage. Decisions affect the type of coverage you get. Certain decisions are time sensitive. There are programs for people with limited income and resources. Medicare resources. So again, the slides will be emailed to everyone if you cannot make note of everything here. But here are resources. Specifically, here is our direct information, Prince George's County State Health Insurance Assistance Program SHIP. Our phone number and email is located here. Please use this phone or email address if you have any questions. Medicare products. So this is a website where you could get more information per topic and more topics. Thank you all for joining the Introduction to Medicare. I hope that the slides was able to provide answers that you had before you began the presentation. If you have any questions, again, please feel free to contact us via email or phone. Please do not forget to list your email address in the chat to receive the slides. This information is very useful in the future, and please let us know if you need us in the future. Thank you all and take care.